Welcome back, friends. Welcome back in another video tutorial from microbiology with Chagnik. So in this video tutorial we are going to discuss about a serological technique, that is agglutination. Okay, so let's get started. So agglutination reaction is a type of antigen antibody reaction. Okay, so in that antigen antibody reaction, the antigen will be specifically in case of agglutination reaction, particulate or insoluble. Okay, and this interaction leads to the formation of visible clumping of particulate antigen when mixed with specific antibodies specific for that particulate antigen. Okay, that means agglutination reaction is an antigen antibody reaction in which antigen is particulate or insoluble, and it leads to the formation of visible clumping. So antigen antibody reaction, so the antibody that agglutinate antigen are called agglutinin. Okay, and if the here the antigen is erythrocyte, then the entire process will be referred to as hemagglutination. And remember, all the antibodies can theoretically agglutinate antigen. That means all the antibody can theoretically form visible clumping of particulate antigen, but IgM, due to its high valency, is a good agglutinin. Okay, because we all know that IgM is a pentamer, right? So that is the reason why they have a higher valency, and that is why they can form cross-linking, which leads to off-cell or cross-linking of antigen, which leads to the formation of agglutination. So agglutination reaction is similar in principle with the precipitation reaction. Okay, remember, agglutination reaction also require equal amount of antigen and antibody. Okay, if antibody is in excess amount, then the agglutination reaction will be inhibited, and in this case the inhibition will be known as Prozone effect. And if antigen is in excess amount, then the inhibition will be referred to as post-zone effect. Okay, so if antigen is excess, then it will be known as post-zone effect. If antibody is in excess, then the inhibition will be known as Prozone effect. You have to keep it in your mind, Prozone and post-zone effect. Okay, agglutination reaction can be further divided into two parts. One is direct, another one is indirect agglutination. Direct agglutination and indirect agglutination. Remember, direct agglutination occur only for particulate or insoluble antigen. Okay, those antigen that are an integral part of cell surface or insoluble particle. And indirect agglutination occur for those antigen who are not a indirect agglutination occur mainly for soluble antigen. Remember, so why? Because remember, agglutination is very sensitive test. Okay, so it is also desired to agglutinate soluble particles too. So what will be the way? The way is artificially coating the soluble particles or soluble antigens, for example viral antigens, polypeptide or hapten or polysaccharide, by coating them on the surface of the cell or insoluble particle. Okay, artificially. This type of agglutination is known as indirect or passive agglutination, because remember, here we are indirectly agglutinating soluble antigen. That is why the term indirect or passive agglutination. So in case of direct agglutination, in case of direct agglutination, suppose this green color portion is antigen. So direct agglutination, the antigen is present on the surface of the insoluble particle or cell naturally. Okay, or integral part of the cell or insoluble particle. But in case of indirect agglutination, our antigen is coated on the surface of the cell or insoluble particle. Then agglutination of that soluble antigen performs. Okay, so this kind of agglutination is known as indirect agglutination or passive agglutination. So as in that picture you can see the clumping of small particle as aided by the agglutinin is called agglutination. Okay, here antibodies are known as agglutinin because they are agglutinating antigens. Now let's talk about zeta potential. What is zeta potential? So remember, the surface of the antigen may possess some charge. It can be positive or negative. For example, in case of erythrocyte has a net negative charge due to the presence of sialic acid. When such charged particles are suspended in saline solution, an electrical potential called zeta potential is formed between particles, preventing them from getting very close to each other. This thing introduces difficulty in agglutination of charged particle by antibodies. Okay. So what does it mean? It means simply, suppose this is a liquid suspension, okay, and this is your antibody. This is your antigen, and on the surface of antigen there is a potential charge. For example, it is erythrocyte, then there is a net negative charge. Okay, so you are suspending those antigen in a liquid suspension. So in the liquid suspension, this negative charge will form a electrical potential called zeta potential, and due to the presence of that zeta potential, they do not, or they prevent from getting very close to each other. Okay, that means one negative charge containing particle do not close to each other, close to another negative charge containing erythrocyte, and as a result cross-linking cannot occur. As a result agglutination cannot occur. Okay, or antibody cannot agglutinate those kind of charged antigens. So this phenomenon is known as zeta potential. So up to that part we have learned about antigen antibody reaction. So here in case of agglutination, the antigen will be particulate or insoluble. So by that reaction there will be formation of visible clumping, right? So here remember, antibody is known as agglutinin because this antibody is agglutinating antigens, right? And if your antigen is erythrocyte, then remember this kind of agglutination is known as hema agglutination, okay, or heme agglutination. Another important thing, that antigen antibody should be in equal amount. If successful, then only the successful agglutination will occur, and if in antigen antibody reaction antibody is in excess amount, okay, there will be inhibition of agglutination and it will be known as Prozone effect. Okay, and if antigen is in excess amount, there will be again inhibition of agglutination and it will be known as post-zone effect. Okay, one is pro, which is in case of antibody, another one is post, which is in case of antigen. Later we have discussed that agglutination reaction can be divided into two parts. One is direct agglutination, another one is indirect agglutination. So in case of direct agglutination, the particulate or insoluble antigen is on the surface of cell or insoluble particle normally. okay, or they are integral part of the cell or insoluble particle. That is in case of direct agglutination. But in case of indirect agglutination, we are artificially coating soluble antigen, for example viral antigen or polysaccharide or viral hapten, on the surface of particulate antigen or insoluble on the surface of cell or insoluble particle, right, and agglutinating them. So here we are indirectly agglutinating insoluble or particulate and soluble or soluble antigen, sorry for that, soluble antigen. So those kind of agglutination will be known as indirect agglutination. Later we have discussed about the zeta potential. So in case of zeta potential, the surface of charged certain particulate antigen may possess an electrical charge. For example, erythrocyte has a net negative charge on the surface due to the presence of stearic acid. Okay, and due to the presence of those charge, when those charged particulate antigen is suspended in a liquid, there will be, or suspended in a saline solution, there will be formation of electrical potential called zeta potential. Okay, and this zeta potential prevent particles from getting very close to each other. This introduces a difficulty in agglutination of charged particle by antibodies. Okay, so we have learned that agglutination can be inhibited by three ways. Okay, so if antibody is in excess amount, then there can be inhibition of antigen antibody reaction, and this kind of inhibition will be known as Prozone effect. If antigen is in excess amount, there can be inhibition of agglutination, and this kind of effect is known as post-zone effect, and in case of antibody it is known as Prozone effect. And if our antigen having a net charge on their surface, okay, because it leads to the formation of zeta potential when those antigens are suspending in a saline solution, okay, and so they preventing them from getting very close to each other. As a result, cross-linking cannot occur, antibody agglutination cannot occur. So these three type of condition can occur in which agglutination of that particular antigen is not possible. Now let's discuss about what we should do when we will facing those kind of situation, right? For example, in antibody excess condition such as Prozone effect, in antigen excess condition post-zone effect, or our antigen having a net charge on their surface which facilitate the formation of zeta potential, and as a result cross-linking of that cell is not occurring. So in order to detect the presence of non-agglutinating antibodies on erythrocyte, one can simply add a secondary antibody specific to the antibody attached to their respective epitopes on erythrocyte. So we all know, if human antibody is injected into another species, then in that species that particular antibody will be immunogenic and leads to the formation of antibody that will be specific for that particular antibody. Okay, and most of the cases those secondary antibody who are specific to primary antibody bind with the Fc portion of primary antibody. Okay, so we are going to use those phenomena, and as those primary antibody are in the interaction with the erythrocyte already, respective epitopes of the erythrocyte. So whenever those secondary antibodies bind with the Fc portion of primary antibodies, they not only detect the non-agglutinating antibodies, but they can also facilitate the agglutination or by cross-linking erythrocyte. So this type of test is known as comb test or anti-immunoglobulin test. So comb test is depending on the two things that we have. One I have already discussed. Suppose the antibodies from a human species are immunogenic when injected to another species. Okay, so antibody from that human species may be immunogenic when it will be injected to another species and lead to the production of antibody in that species. So this antibody that is produced in that particular animal can be show specificity towards the human antibody. Okay, and that many of that anti-immunoglobulin rabbit anti-human antibody, here we are using rabbit as the second animal, bind with antigenic determinant of the Fc portion of the antibody and leave the FAP portion free for interaction with the antigen. So for example, if human IgG antibodies are attached to their respective epitopes on erythrocyte, then we will add those human IgG antibody into a rabbit and there will be formation of anti-human antibody in the rabbit. Okay, now if we extract those anti-human antibodies and inject them in human, so now if we extract those secondary antibodies or anti-human antibodies and then inject them in our sample, then those antibodies simply find out the human antibodies that are already in interaction with erythrocyte, okay, or specific respective epitopes on the erythrocyte. So these rabbit antibodies help in cross-linking and agglutination. So there can be two versions of comb test: direct comb test and indirect comb test. So in direct test anti-immunoglobulin are added to the erythrocyte are suspected of having antibodies bound to the antigen on surface. And in case of indirect comb test, the indirect test is used to detect the presence of antibodies specific to the antigen on the surface of the erythrocyte on the serum. So for example, this is the diagram of direct comb test, where anti-human immunoglobulin are added to the patient sample on erythrocyte, suspecting that erythrocyte having antibodies on their respective epitopes. Okay, so as you can see, their antibody is already present, but things are different in case of indirect comb test, where initially the erythrocyte do not possess any kind of antibody. Okay, so here anti-immunoglobulin will be added to detect the presence of antibodies on the surface of antigens on the surface of erythrocyte in the serum. Okay, so in direct comb test, our antibody is already present on the surface of the erythrocyte, but in indirect the things are different. So comb test, what is comb test? Comb test is a solution, I should say, for antigen agglutination reaction, where in which antibody is in excess amount in some cases. That means it can resolve the Prozone effect, it can resolve the post-zone effect, which is due to the amount of excess antigen, and it can also resolve the Zeta potential effect. Okay, so what is comb test? Comb test is nothing but addition of another anti-immunoglobulin or another antibody which is specific for the primary antibody, okay, that are in interaction with the respective epitopes of the erythrocyte. So this anti-immunoglobulin is usually used to detect the non-agglutinating antibodies on the erythrocyte, but they not only detect the non-agglutinating antibodies, but they also cross-link them. Okay, so and facilitate the agglutination. This test is known as comb test or anti-immunoglobulin test. and this comb test is used in two fact, okay, or it is based on the two fact. One fact is that many of the anti-immunoglobulin, for example rabbit anti-human antibody, bind with antigenic determinant of the Fc portion of the antibody and leave the FAB portion free to interact with antigen. And another one is, remember that if a human antibody is injected into a rabbit, so in the second species the human antibody may be immunogenic and rabbit will develop a antibody specific for that primary antibody, specific for that human antibody, okay. So this kind of antibodies will known as secondary antibody. Now this secondary antibody can be added to the system, and this secondary antibody will simply bind with the Fc portion of the primary antibody, leaving FAB portion free to interact with the antigen, okay. So that is the base of the comb test, okay. So here I have provided example and direct comb test, indirect comb test, okay. So in case of indirect comb test and in case of direct comb test, anti-immunoglobulin we are adding to on the erythrocytes suspecting of having antibodies bound to their antigen on surface. Remember, here in case of direct comb test, antibody is already present on the surface of the erythrocyte, but in case of indirect comb test we are adding anti-immunoglobulin to find out antibodies specific to the antigen on the surface of the erythrocyte on the serum, okay. So what we have learned? We have learned today that antigen antibody reaction, okay, is the agglutination only when the antigen is particulate or insoluble, okay. Now this antigen antibody reaction in which the antigen is particulate or insoluble leads to the formation of visible clumping of antigen, okay. And antibodies that agglutinate antigen, this kind of antigen, are known as agglutinin, okay. And if our antigen is erythrocyte, then those antigen antibody reaction will be known as heme agglutination reaction. And now this antigen antibody reaction can be inhibited by various kind of way. For example, the antigen antibody, the amount of antigen antibody in an agglutination reaction should be equal, but if the amount of antibody is in excess, so in those kind of situation agglutination reaction may be inhibited, and this kind of situation is known as Prozone effect. If antigen is in excess amount, it can also prevent the agglutination, and this kind of situation is known as post-zone effect, okay. And agglutination reaction is divided into two parts. One is direct agglutination, another one is indirect agglutination. In case of direct agglutination, remember antigen is present on the surface of cell or insoluble particles naturally, okay. So, or in other words, antigen is the integral part of the insoluble particle or cell. And in case of indirect agglutination, we are indirectly agglutinating soluble particles, okay. For example, viral, protein or polysaccharide, hapten, okay. So in that case we are coating those antigens on the surface of insoluble particle or cell, and as a result it leads to the formation of agglutination, that is indirect agglutination. So then we have discussed about the zeta potential, that is in some cases some particulate antigen contain a net charge on their surface, okay. For example, erythrocyte possess a net negative charge. Due to the presence of those net negative charge, when those erythrocytes are suspended in a liquid saline solution, it leads to the formation of a electric potential, okay. And due to the formation of those electric potential in the liquid or in the saline solution, the antigens prevent them from getting very close to each other, and as a result there will be no formation of cross-linking, so agglutination will not occur. Okay, so we are using comb test to agglutinate those antigens that are having a particulate, that are having a charge on their surface. Okay, so in that case we are simply adding a extra anti-immunoglobulin. Okay, so these anti-immunoglobulin are specific for the non-agglutinating antibodies that are in attachment with the specific epitopes on the erythrocyte. Okay, so once they detect the non-agglutinating antibodies, they not only detect the non-agglutinating antibodies but they also facilitate agglutination. Okay, so this comb test is based on the two facts. Here remember, we are using the principle that human antibody, when injected into a rabbit, in the rabbit the human antibody become immunogenic, and as a result rabbit will produce, or rabbit's immune system will produce a antibody specific for that human antibody. Now we will simply extracting those antibodies, and those antibodies can be used as a secondary antibody in our reaction or in the comb test. Okay, and this secondary antibody will bind specifically with the Fc portion of the antibody, remember. Okay, and leaving FAB portion free to react with the antigen. So comb test can be divided into two parts. One is direct comb test, another one is indirect comb test. In direct comb test, remember, antibody is already present on the surface of erythrocyte. So here direct anti-immunoglobulin are added on erythrocyte suspecting of having antibodies attached to their respective epitopes. Okay, and in case of indirect comb test, the anti-immunoglobulin are added to detect antibodies attached with the erythrocyte on the serum. Okay, remember here antibodies are not directly present on the surface of erythrocyte. That is why the name indirect comb test. So this is the ending of today's video. So today we have discussed about everything regarding agglutination. Okay, so here the main important part is obviously the comb test. So I hope this video will be helpful to you, and if it is, please hit the like button, share with your friends and subscribe to my channel to get more videos like that. Thank you for listening to this class.